glad you're all here. And I'm actually going to tell you kind of a story today. It's a story about the work that I've been involved in for the past almost decade. And I work at a place called RNBC, or the Rush Neurobehavioral Center. And we do a number of things. One of the things that we do is we do clinical work. So we see kids with neurodevelopmental, neurobehavioral issues, and we really search to find out what their strengths are, what their issues are, work with their families and their schools, and help to create environments that really bring out those strengths and help them overcome those weaknesses. We have a wonderful education and outreach department, and we do a lot of work in the community educating teachers and parents and all kinds of professionals. And the main thing that we focus on in our education department is an area called executive function or organizational skills. And we've created a wonderful executive function curriculum which is now available across the country. And then there's our research. And our research is on social emotional learning, and that's really why I'm here today to tell you about the story of how our research started and where it's come to and hopefully where we're going. So here's a picture of all of the people that make up the Rush Neurobehavioral Center. These are great, hardworking, passionate, caring, fabulous folks who really make it happen. And the work that I talk about is the work that they do. And so they really deserve lots of kudos. And then, of course, there's the kids that we care for. And they come in all colors and shapes and sizes. Some of them are a little, one might say, exuberant. Some of them are a little spacey. And some of them have a really hard time with academic learning. But the ones that we're going to focus on today are the kids that have a difficult time with social emotional learning. And social emotional learning, A Key to Friendships, is actually the name of our conference today, so I thought I'd put that up and keep me focused. In terms of social emotional learning, I'm going to take you through some ideas about the nature of social emotional learning, assessment, research, and some interventions that we are engaged in, and some interventions we hope to engage in. So first, let's just think about the nature of social emotional learning. And I'd like you to just first start thinking about really how exquisitely social we as humans are. And when we sit here to learn, not alone, we sit in a group. And so much of our lives is really based on functioning with other people. It's really all about relationships. This is a picture of a soccer event, and one can tell just by a quick look that something didn't go well. And you can see the expressions and the similarity of expressions of those people and how distraught they are. You don't know them, but you can make up a story about what's happening. And every once in a while, you'll see some guys with yellow shirts that are kind of happy. So you know exactly what happened here. There's a wonderful neuroscientist named Ralph Adolphs, and he works down south and does a lot of work on social cognition. And some of the ideas that I'm going to share with you really came from his work. But there are, let's say, three kinds of knowledge. There's non-social knowledge. You know, we can look at mountains, we could look at trees, we could look at walls, we could look at lights. Those are non-social beings. Then there's the knowledge that we have internally in our own minds, a second kind of knowledge. And a third kind of knowledge is knowledge of other people's minds. Now, when you look at this picture, you can sort of tell a story about what's happening here. You might figure out what these girls are saying and how maybe this girl is feeling and really what's happening. And a lot of social emotional learning has to do with really knowing not only what's in your own mind, but really focusing on reading other people. So how does the brain create this kind of knowledge? And of course, as a neurologist, I'm really interested in the brain piece of this, although a lot of the work we do, of course, is in the environment because that's what we have to work with. There are old and new parts of the brain. And the old and the new parts of the brain, certainly in our brains, work together. Often when we think about emotion in the brain, we think of some of those old parts of the brain. And the new parts of the brain are much more regulatory. So that's one theme. And that there are neuronal networks, which were really shown beautifully, that observe different functions in the brain. And what we need to think about is the functions that have to do with social emotional learning. So that there are nuggets, and then there are connections. There are nuggets that help us read each other's facial expression. There are nuggets that help me kind of see if you're interested in this. And so the brain has various networks that really help to function, us to function in terms of our social emotional learning skills. Then there's the thought that the current level of brain evolution is associated with social aspects of our culture, and that in a Darwinian way, the development of our very, very social human experience has made the brain develop so that we can partake in that very, very human social experience. The colored parts of this is just a picture of a brain, and this is the front and that's the back. It's sort of on the you're looking at a side view, the bottom and the top. And the colored parts really are parts that have been defined in neuroscience as having to do, those nuggets that have to do with social emotional learning. Some that are very popular are these kind of yellow mustard colored ones are the amygdala, very, very important in emotion, being able to function with your emotions. And then this is the medial frontal lobes that have a lot to do with the higher levels of emotion and emotion regulation. Social emotional learning itself is really a group of thinking, feeling, and regulatory skills that we use every day, all the time, as we relate to each other. And these are skills that we use to encode, to interpret, and to problem solve with social emotional information. So let's kind of ask some questions that come up really frequently, like, what does it take to be socially successful? What does it mean to have social competence? So it means that you can read this little boy's facial expression and you can tell me that he is, yeah. And that you can read the gesture, and this probably real estate agent is saying, come right in, right? You need to be able to read body language. So without that facial, kind of, so much of what we do is read faces, but we read these other parts too. So if you look at these kids, are they happy, sad, angry, fearful, disgusted, embarrassed? What emotion do you see in this non-facial picture? Right. Isn't it amazing? And what would it be like if you couldn't read that? If you didn't really know what they were? How would you begin to initiate a relationship with them when you have no idea what's happening to them? These two, happy, sad, angry, fearful, disgusted, what are they? And you could tell. You could tell by their body language. So body language is very, very important. These two have a certain empathic connection. And how we are with others, how we can read their feelings or feel their feelings is a very, very important part of being socially successful or socially competent. The other thing that we do is we read people's minds. And in a game like chess, for those of you who played, it's very, very important to understand the moves and where the pieces go, but you get a lot of information by looking at that other person's face. Now, there's a story in here, right? And this little girl has a problem to solve. This little boy is sort of looking at her work. And what can she do about it? Well, she can tell him to kind of look away. She could ignore him. She could ask the teacher for help. She could shut her book. I mean, there are various things that she could do. Her choice so far seems like a good one in some ways. She's ignoring him. But social problem solving is a very important part of social success and social competence. And then this little girl has a problem, but she doesn't know it. And this little boy has a way of being which really gets in the way of social success. And he has a difficulty with his self-regulation, which turns out to be a very, very important aspect of social competence or a lack of it. So how do we acquire social skills, social emotional learning skills? Well, Hippocrates really focused on the brain, and as a neurologist, guess what? Me too. So when you look at kids that are interacting well, remember, there's a lot of brain work going on there to make that happen. So the brain is important, but it's not the brain alone that is important. And when we think of the brain, it's important to think about those specific areas of brain that are really bound to social information. So we think about the brain as one piece of where social emotional learning comes from, and I think it's important to keep in mind, like other skills that we have in our brain, whether it's doing mathematics or being a good scholar in history, it comes in small, medium, and large. So the brain brings some of that. And then there, of course, is the important role of genetics, which is huge. So often I sit in my clinic, in my office, and I meet two parents who have concerns about their child who has no social interest. And I often will ask, on a scale of 1 to 10, 10 is a social butterfly, 5 is medium, 1 is a loner, where are you? And often one of those parents are at 2, And so why is it that their child doesn't have social interest? The apple and the tree are related. So genetics is really important. And then what happens in the environment is very important. And with the data that's come out recently about autism and the molecular or chemical environment, that's one piece of environment that is important. But what happens to the child day to day, what that life in the family is like, is also really important. What happens in their peer groups, what happens in their schools, what are their learning experiences in terms of social emotional learning. So frequently I find that if a child has a disorder of reading words, the parents have letters and words all over the house and everybody's working on reading, but if they have social emotional learning impairments or difficulties, parents sort of think, well, you can't teach that. Well, you can't. So it's kind of all of these factors together that we have to think about as we want to bring environments that really build kids' social emotional learning abilities. So what's so important about social emotional learning itself? Well, it's really the basis of having good friends. It's the basis of friendship, it's the basis of relationships. And so for many of us, that's a really important aspect of our lives. It helps us as we go through school because you know what? In school we learn in groups. It helps us in work because in work, how many of us work alone? I mean, we all, or not all, but many of us work with other people. Being able to read and function well with other people makes work go better. And we are an intensely social species. For those of you who are sitting here, if you think about, kind of how you spend your time, many of us wake up in the morning and have somebody next to us in our beds. We sit with our families and we have breakfast. We often will go to work if you live in a big city on a bus or a train with other people. You go to work and there are other people. You might go out for a drink if you have time, or you go home to your family. So many of our hours are spent with other people. And our abilities in social emotional learning will really help us to be more successful in life. So these are very important skill sets. We know that social emotional learning, and I'll tell you a little bit about a study that we did that shows the relationship between social emotional learning skills and academic outcome. We know that social emotional learning skills are correlated with mental health. And for those of us that are getting that gray in our hair, we know that good relationships are associated with better physical health and longevity. So how important is social emotional learning skills? Really important. And who has these issues? Well, sometimes you can't really tell from a picture, while other times you can. It's pretty easy. The fact of the matter is there are 4 million kids in our country, school-age kids, who have experienced social rejection. And that's not even all the kids that have social emotional learning issues. These are the ones that have gone to the point of being rejected. So this is a big problem because that's 1 in 10. So when we started thinking about social impairment, we were actually just beginning and thinking about kids with nonverbal learning disabilities, kids whose social skills were not so good, their visual spatial skills were not so good. But we started attracting lots of kids with social impairments, and they had all kinds of diagnoses attached to them. Certainly the autism spectrum diagnoses like Asperger's syndrome or PDD-NOS, which is my least favorite all diagnoses in the world. High-functioning autism. By definition, these kids have social impairments. But kids with ADHD have social impairments. Kids with academic learning disabilities have social impairments. Kids with mood disorders and anxiety disorders have social impairments. And so we found that the labels, those diagnostic labels, don't really help us help the kids, because it doesn't tell us about their social emotional learning issues. So what we did was we decided, okay, so we're going to look at social emotional learning from a non-diagnostic kind of viewpoint, without the diagnoses. And it sort of is, and I put typical kids in there because there are kids that really don't have diagnoses that are having social issues. And it would be nice for them to not have diagnoses. And I say that because I think we overdiagnose and overcall social impairments right now. But the way the thinking was that maybe 60 years ago, when we didn't know what dyslexia was and it was just sort of labeled, we parsed out all the different parts of reading. You know, the ability to read letters, to make sounds from letters, to be able to put sounds together, a certain level of fluency, a certain ability to rhyme. We figured out what it takes to be a reader. And then we measured those subsets. And as we measured them, we found out, what was strengths, what was weaknesses, and we developed interventions. So what we wanted to do was use that model with social emotional learning. So we took social emotional learning and we broke it apart into comprehension, how we take in social emotional information, and then the execution piece, how we do it. So we worked on the comprehension piece. We broke it down into awareness, which is reading social cues, nonverbal social cues, meaning, interpreting what's going on, being able to understand what's happening in somebody else's thoughts, being able to feel somebody else's feelings, and reasoning, which is social problem solving. As we started this work, the idea of the importance of self-regulation just kept hitting us in the head, so we put it in there. And we found that we were so busy with looking at comprehension that we put execution off, and we are still working on how to work with taking in social emotional information. So the conceptual model is that we start with the idea of social success. Social competence is another way to say that. And we are assuming, we hypothesize, that there are certain social behaviors or social skills that one needs to be socially competent. And in our model, those skills have to do with awareness, being able to read those cues, meaning, being able to interpret them and having empathy and mentalizing ability, and reasoning, being able to socially problem solve. Those three factors would really make up social skills. And then again, we have self-regulation, which we've come to really recognize as so important in social relationships. And so this was our hypothesis, that awareness, meaning, and reasoning gave you a skill set, and that if you had that skill set, that you would be socially competent. And somewhere in there, self-regulation was playing a really, really important role. So we started to look at the assessment of social emotional learning. And we found that certainly you can observe in a social context and take good notes and really understand a lot that way, that there are these other ways of measuring social emotional learning, and I'll go into them just a little bit. There's lots of rating scales, and rating scales can be very, very useful, but there is a limitation of rating scales because it depends on the person who's doing the rating, how they're feeling that day, other experiences they've had with that child. You know, we do the rating scales for some of our work, but we really wanted something that was going to give us a much more clear, rigorous picture of what those kids' social emotional learning skills really were. Another wonderful way to look at social behavior is to look at a network. Like in a classroom, you individually ask kids, you know, who do you like to play with? And then you make a network of it. And it tells you lots about the individual kids in the classroom as well as the sense of the classroom itself. And you can do these networks before and after some kind of intervention to see if you've made change. You, of course, when you see a network like this, are going to worry about this little guy out here who has no connections. So the networks are interesting. But again, we wanted something that was much more rigorous, that was going to give us, like, information that you can get when you do a really good reading evaluation. So what we did was we attempted to do that and had got profiles that sort of look like this, where along the bottom you have the specific skill sets, and then across here you have how well the kids are doing. And anything, you know, above 85 is within the normal range. And so then you get a pattern of strengths and weaknesses. And what that gives you is if you have a child who has this particular pattern and you want to help them, you know exactly where to go to help them. This child needs help in social problem solving. So this is the assessment that we put together. Much of it, not all of it, but much of it is computer-based. And we started out with awareness. And we looked at reading cues in faces, voices, postures, gait. And here's an example. This is a Dan Vitesse put together by Steve Nowicki and Marshall Duke. So is this boy happy, sad, angry, or fearful? Excellent. And this one? Yes. I just put him because I love him. I think it's just amazing, isn't it? Okay, so which two faces show the same emotion? 1, 2, and 3. Very good. Happy, sad, angry, scared. Huh? Yeah. And this one is? Yes. Very good. Okay, so we looked at some of the measures of awareness. Now we're going to look at meaning. And meaning, again, is the interpretation of emotional, language, and cognitive signals within a social context. So we looked at, any speech and language people know, the CASTLE, the Pragmatic Language Test. We use that. We use strange stories and the NEPSI-2 for looking at it, interpreting others' intentions or mind reading or mentalizing. And then interpreting others' feelings, we used a self-report of empathy. And here's an example of each of these. So now I'll tell you some stories about children. Then I'll ask you some questions. You tell me what you or the children in the stories should say or do. During break, Sam wants to play a game of chess with a boy in his class. What does Sam say? So it's really knowing how this kid can use language socially. And then strange stories, for those of you who haven't seen that. This task has some different stories and questions. I'll read each story to you, then you help me with the questions at the end of each story. Emma has a cough. All through lunch she coughs and coughs and coughs. Father says, "Poor Emma, you must have a frog in your throat." Is it true what Father says to Emma? No. Why does he say it? So a person that can mentalize knows the difference between what he says and what he means. But there are kids who don't know the difference, and they think that there's a frog in her throat. And that's a very important piece of information, which developmentally has different meanings at different ages. Now for the NEPSI-2. We're going to do many different things. Please listen very closely when I show you a picture. Look at it very carefully. Philip saw a box with a bow on it and thought it was a gift for him. When he snuck a peek, he realized it was a baby blanket, probably for his new cousin. When Philip's brother saw the box, what did he think was in it? Any takers? Take a risk. The idea is that Philip's brother is not going to know what's really in the box. What? Probably, just like his brother did. Yeah. But he's not going to know, because he's not going to have the knowledge that his brother gained by looking in the box. That's the way of looking at mentalizing. And again, very important developmentally. The self-report of empathy, I read you some sentences about things kids sometimes do, and you tell me how true they are for you. Things like, it makes me sad to see a boy who can't find anyone to play with. I get upset when I see a boy or a girl being hurt. And the kids fill these out. And you know, these are pretty language-based, and that's sort of one of the limitations of these. But here's one that I want you to think about. We don't use this, but I'm like hoping that we're going to develop a way to use something like this. This was put together by a wonderful neuroscience researcher who looks at empathy. That's what he studies. His name is Jean Dessetet. He's at the University of Chicago. And let's say we have a pain scale, and the pain scale is from 1 to 10. 10 is the worst pain you've ever had in your life. 5 is medium. 1 is no pain at all. When you look at this picture, how much pain do you experience on that scale from 1 to 10? Really? Watch out. All right. Anybody else? Okay, here we go. Hold on, especially whoever had that 7. Hold on. But isn't that a good measure? I mean, wouldn't that tell you? I mean, on a scale of 1 to 10, it's like 13 or 17. So I would like us to be able to develop something like that for our measures. But I happen to think that empathy is such an important part of social emotional learning that it would be great to get a good measure of empathy. So then we go on to social reasoning. And we've worked with some social problem-solving methods that a woman named Nurit Bauminger put together. She's wonderful, and she's in Israel. And this is what we use. Pretend you are on the playground. Ken has been on the swing for a long, long time and doesn't seem to want to share it. You really want to play on the swing. Is this a problem? What is the problem? You don't have to tell me because I know you know. What would you like to have happen? And what are all the things that you could do? And there's a long list of things that you can do. And then which of those would you choose? So these are the kinds of questions that kids answer so we can get at their level of social problem solving. So then we looked at self-regulation, and many of you may know about the wonderful work of Walter Mischel at Stanford, who many, many years ago worked with preschoolers, gave them a marshmallow and said, if you wait, you can have more marshmallows. And then he measured in seconds their waiting time and found many years later when he looked at those preschoolers who were now high schoolers that the waiting time in seconds predicted kids' academic and social behavior. So, you know, this is a very, very important factor. And sadly, there aren't really good ways to measure self-regulation. There's a researcher at the University of Pennsylvania named Duckworth who's done this with middle school kids and dollars. So if you can have $1 now, and if you wait, you can have more dollars. I'm not sure if it's because it's an expensive way to do it, but it doesn't really work as well as the marshmallows in preschoolers. So we're looking for really good ways to measure self-regulation. In the meanwhile, there are forms that can be filled out, like a test like the brief, pieces of the Vineland, part of the Basque-2, the Connors, and the SSRS will give you some measures of observed measures, which are not the kind of measures that we really love, but it might be what we have right now. So that's the assessment battery that we put together, and then we did a research project. And the idea was to really look at kids' social emotional learning skills in a rigorous way and get not what other people observe, although we use that information. We really got what these kids could do. And there were 186 kids. They were in two schools. One is a little suburban school, and the other is a parochial school in the middle of busy Chicago. The kids were K through 8, and we got all kinds of data on them. I mean, we got the social emotional learning data. We got observation forms from their teachers and from their parents. We got cognitive data. We got standardized tests. We got, kind of just a wonderful set of information about these kids. And what we looked at was their scores on awareness, meaning, and reasoning. And we did a confirmatory factor analysis that demonstrated the relationship between awareness, meaning, and reasoning and their social skill or social behavior. And then we did an equation modeling to see how all the pieces fit together. And I am not the person who knows about statistics, but I know it showed in a general way. And these numbers really demonstrate that the relationship between awareness, meaning, and reasoning really sticks together and gives you a good sense of social skill. So, the tests take time to give, and it's not so easy, but what you get is a really good piece of information about kids' social skills or social behavior that does predict social success. But the big predictor of social competence and social success is self-regulation. Okay, the other thing that we looked at with this amazing amount of data, and there are like, 8 or 9 other things that we're looking at, but one that's done, is to look at the relationship between those SEL skills that we measured in a one-to-one way and their academic achievement. Because if you look at the data on academic achievement and social emotional learning up to this time, it's not very clear. And our concern was that it's not very clear because social emotional learning was only measured by observation. not by the rigorous kinds of evaluations that we were able to give. And that's exactly what was shown. The social emotional learning skills as measured in our assessment battery really showed the relationship with academic achievement, which is really important, especially today when there are so many social emotional learning curricula around, you know, and with money being short, where are you going to put your dollars for kids? And this is a demonstration that putting your dollars in social emotional learning education is really important. So once you assess and once you get to know, you know, what's working and what's not working, what's left is how do you make the kids better? How do you intervene? And so while we're continuing to work on assessment, and I'll show you some new assessment tools that we're using, we're also working on intervention and how to use that information that we have about kids and really help them with their social emotional learning advancement. So we have we took our assessment battery that we used in research and we created from that a battery that we use in our clinic. So if a kid comes in with social emotional learning issues, they get this test and they come out with a profile of strengths and issues. We have a new measure of social problem solving, which I'll show you, called the VSIP. And then we were intensely gratified and lucky and happy to have gotten a grant from the Department of Education for $2.4 million to take our assessment battery and put it on a website, simplify it, and have it available to schools across the country. So we just, July 1st, started working on that. In the intervention area, we have a group model that we're working on, and then we have some individual skill training that we're working on. So we're going to talk about these for a few minutes. So the assessment clinic battery, this is what we get out of the battery, and it's interesting. This is this shows what the behaviors are and the social emotional learning skill sets, what they are, and how this is a little girl, and how she's done. And anything over 85 is within the normal range, and higher is always better. Now, this is an interesting girl who I've followed for many years, and there's always been an issue with her not being able to connect with other people, although she always wanted to connect and had social interest. She has attentional issues, she has anxiety issues, she has other learning issues, some language-based learning issues. She has a broad set of issues. Now, this girl's ability to process accurately kids or other people's emotions is very, very low. And her ability to read somebody else's mind is also very, very low. And with these two characteristics, one might say, well, is she on the spectrum? I mean, those are kind of, that's where that would take you. And it's interesting because she's not. She has lots of issues, but she's definitely not a spectrum girl. Now, the nice part of having a piece of information like this is when you want to help her, you know exactly where to go. You have a focused need for intervention. That's the nice part. The sad part is we don't have so many good interventions for perspective taking, but that is certainly something that we need to work on. And this is a boy who definitely, you know, if you meet him, if you see him, if you examine him, if you test him, he's autistic. And it's sort of not a hard diagnosis for this kid. But what's interesting to me is his level of social interest. And this is a boy who has, for whatever reasons, be they as they may, has not had any intervention. And I first saw him when he was 7, and I think this was done when he was 8. Now here's a boy around the same age who also is not a difficult diagnostic question when you meet him, when you evaluate him. He's he's autistic. And he has had tremendous interventions. And I think, and this is not a pre-post test, this is just how I think about him. I think we see a lot of this wonderful purple here because of the great intervention that's been done. So the battery is really helpful in a clinical way. And we're working on always to make it better. So let's talk a little bit about the VSIP. And the VSIP is a virtual environment for social information processing. And it's really to make instead of just reading a bunch of words and telling a story to a kid, it's giving them some visual experience, and an experience that's not real life, but as close as we could get, to see what their problem solving is like. Anyway, I'm going to tell you a little bit more about the web-based assessment that we're doing, and review the fact that there are 40 million school-aged kids, and 1 out of 10 have social rejection. A big number, and I think this is why the Department of Education is so interested in this. So in the web-based assessment, we're going to do this for kids, the young kids, K through 3, and there'll be an assessment battery that mirrors the areas that we have in our clinical assessment battery. So we're going to start with a universal social rejection screener, which is made up of 3 questions that we ask to teachers. How many of your students' peers like or accept him? How many of your students' peers dislike or reject him? How many of your students' peers ignore or feel neutral about him? And then there'll be a cutoff. So in that universal screening, either the kids, don't have enough of an issue, and so no action is taken, or they do have enough of an issue and they have a secondary screening. And that secondary screening will probably be an observation form, but we're not really sure yet. After that secondary screen, we'll do the diagnostic evaluation, which will then be able to give kind of a profile of strengths and weaknesses and some suggestions for intervention. So for us, the idea that we're going to be able to take this information and give it to schools across the country, that there's no specific charge for it, that it just gets it out there, is, I think, for us, it's really exciting. Okay, so now we have as much as I can tell you about our assessments, and I'm going to tell you a little bit about interventions. So we have our group model, and we have individual skill training, and those are the 2 areas that we're looking at. In the group model, we have groups that we do in our clinic, and then the lighter color indicates that we are trying to put together a clinical trial. So this is a group model that's all manualized, and what we want to do is a big study of it. In skill training, we look at the various skills: awareness, meaning, reasoning, and regulation. And the 2 areas that we have ongoing work in is in awareness and regulation. And we are working on getting something going for empathy and mentalization, which is meaning, and for social problem solving. What we want to do is use the VSIP not only as an assessment tool, but as a teaching tool. But that's not up and running yet. So our clinical groups, what we do is we have a group with 1 or 2 leaders with 4 to 7 kids in it. And it's a 1-hour group, and the skill sets are manualized, and I'll show you a list of the skills that we work on. There are facilitators, and this is an interesting piece. We really believe that that the interpersonal dynamics of those kids are really important, and it's very, very hard to manualize that kind of work. But we feel that it's so important that we didn't want to give it up, so we are doing our best to manualize a piece of that, because we think it's a very important piece of how those kids come together. These are groups that last for the entire academic year. And so there are lots of ways that these kids relate to one another, And there's lots of learning in that interpersonal connection, and the dynamics are very, very important. So it's a manualized group, and it's a dynamic group, which is different than most of the literature writes about. We have a time for semi-structured play, and we always do an assessment before. So we do our assessment battery that gives us a picture of profile of strengths and issues, and from that, goals are developed. And then we measure at the end of the group. This is one of the summaries for pre-group, and it lets the families and the kids and the teachers know, where the kids' strengths are, where their issues are, and where the goals are coming from. And the kids, when age appropriate, have a lot to do with choosing which goals they want to work on. So this is a list of the manualized pieces. So there's, nonverbal communication, behavioral regulation, pragmatic language, and there are 32 sessions, and this goes over the school year. So the kids, beyond this manualized learning, beyond the education piece, which I definitely think is important, it's the connections that the kids make and how they learn to be friends, and the things they do outside of group that affect how they are really growing in terms of their social emotional learning. That, as an outsider looking in, to me, that's the most exciting part. So we're going to look at one of the curriculum within a manualized piece. But first we're going to talk a little bit about generalization. So if you know the literature on social groups, often social groups can be effective to have behavior change within the group. But when you get outside of the group, the behavior is sort of the same. And so generalization is a very, very important thing to work on. So we share the goals with the teachers and the parents. We do consultations with the teachers. We give them bridge lessons that they can do in their classroom if they'd like. We have parent meetings, individual parent meetings, and workshops for parents so that they begin to really take on teaching social emotional learning to their child within the home environment. And the group is heterogeneous. They're not all ASD kids, they're not all ADH kids. They're heterogeneous, which is more like real life. So we hope that those features are going to really help with the generalization of what the kids learn in the group. So nonverbal social communication is one of the manualized areas. And of course, it's the basis of connecting and friendship. And so one of the things that, and especially for the younger kids in these groups, they work on all kinds of feelings. They have feeling pictures, they have feeling experiences, they have feeling words. They work on recognizing feelings within themselves and feelings in other people. They read feelings by gestures and postures. They learn about interpersonal space. And we use this mind reading computerized educational piece because there's lots of rich information in here. Then we have games for the younger kids that teach about facial emotion recognition. So that's what I'm going to share with you about the group model. Now we're going to talk about skill training. So in terms of skill training, we're looking at our current projects are on awareness and regulation. And for awareness, we have a project around facial affect recognition. So how to teach kids, like that little girl who we saw who had her, who couldn't read nonverbal cues and faces. This would be a perfect intervention for her. So there's a video program that's ready for the computer use, and it's called Human Intel Mix. Whoops. And that's what the program basically looks like. And you have faces with different emotions. And that's supposed to be used with adolescents or adults, and they just go through it by themselves. So what we've done is we have added a coach that works with a child, and they're instructed on 7 different emotions, And the kids are cued to attend to, different areas of the face. And we've added a piece where we have the kids imitate the emotion. So not only do they see it, they feel it. And if we believe that mirror neurons really connect emotion from outside to inside, we're really exercising these kids' mirror neurons. And then how fast they read the emotion is noted, and you can make the emotion appear faster or slower, so you can take it away faster or slower if you need to. Because the accuracy is one piece, but how long it takes to read an emotion is really important. Because if it takes any length of time, you're lost. And people expect, especially age mates, expect you to read emotions in milliseconds. And then we have assessments after each of the sessions. And we look, our goal is for the kids to get 80% correct in a fifth of a second and have 3 consecutive sessions. And this is the form of the assessment, another face with an emotion, and you recognize what it is, and we know how long it takes. This is a pilot that we did on 3 kids, and it's interesting. They all kind of got to where they needed to go, and you'll see that, like this child here, went up and then he went down, and the reason he went down was because we changed the time. We made it shorter for him. And so it took him a little while, but he got right back up there. And that's true of all the kids. When we shorten the time that they have, then their scores go down, but they all got up. And we just got funded for a project to do this exact thing with 50 kids, so that we have a much better statistical frame to use. So we're going to talk about an intervention for self-regulation, and it's mindfulness training. And mindfulness training comes from the Zen Buddhist philosophy, and originally was used to help control pain in adults. This was maybe 15, 20 years ago. And more recently has been used in children for the regulation of attention, behavior, mood, and anxiety. And there are different elements. A lot of self-relaxation is taught, visual imagery, and various kinds of heightened sensory awareness. So we did a project, and Bernadette led this project at the Summit School, which is a school for kids with learning issues, social issues, attentional issues, and it's in the Chicago area. And so the focus was on enhancing attention, decreasing activity level, decreasing anxiety, and stabilizing mood. And there were different elements. So for the 4th through 7th graders, there were 2 groups, one for 4th, 5th graders and one for 6th, 7th graders. There were mindfulness moments, which I'll share with you what that is. And then there were also parent activities, and there was pre and post measurement so we could see if anything happened. We just got the data, so it's not been analyzed. So the mindfulness groups occurred once a week, and there were 10 groups for 10 weeks, or there were one group per week for 10 weeks. And the topics covered were things like your breathing, tasting, relaxing, listening. And not all of the kids in the 4th through 7th grade were in it, only part of them were in it, so we have sort of a little control in there. And I'm going to read to you what the kids experienced in their mindfulness group. So today's lesson is on breathing. Today we're going to pay attention to our breath, our breathing. We'll stay seated. Best to sit with both feet on the floor. You can try it. Hands on top of your legs. Sitting on the edge of the seat, back straight. Flex shoulder blades, chin tucked a bit. To start, put one hand on your stomach and one hand on your chest. As you're sitting there, just notice your breathing. Notice your stomach and chest rising up and down. As you're doing this, if you start to think about something else, just tell yourself, notice your breathing. Notice your hands going up and down and your breath going in and out. We're going to sit here and do this for a few minutes. If it helps to close your eyes or look downward, fine. You may notice thoughts, ideas, music. Just gently remind yourself to focus on your breathing. And the kids do really, really well with this. You can open up your eyes. The kids really like it. They look forward to coming to group. And that's one of the lessons that they get. Then there are these mindfulness moments, and the head of the school really thought of this and added this to it. So over the loudspeaker, she will do mindfulness moments every day, and this is for the whole school, not just the kids who are getting the group. And so we're going to do one of her mindfulness moments. Hi class, starting today and through next Wednesday, we're going to pay attention to foods we eat. Before we begin though, let's practice paying attention to your breath. Think about how air goes in and out of your nose or mouth, how your chest and stomach go up and down, and how this relaxes you. Let's start. Your teacher will pass out a package of jelly beans. First, take one of them and look at it. So why don't you look at your jelly bean? Notice the shape and the size. Now, put it in your mouth. Don't chew it. Just move it around in your mouth slowly and think about how it feels in your mouth, what it tastes like. Okay, good. Now slowly bite into it. Notice how it feels and the taste. Take your time chewing it. Okay, now slowly swallow it. Notice how it goes down your throat and into your stomach. After doing this, you may feel more relaxed and realize that you did a nice job paying attention. That's it. As I mentioned, there are parent activities, and some of the parents really get into it, and some of the parents don't. And we try to get information from the parents so we can look at that in terms of the data that we get. Here are the pre and post measurements that we do. We look at attention and activity. We use some neuropsychological measures. There is a mindfulness measure that we're using. We also use the BASC, which the teachers and the parents fill out. And then we have behavioral observations and videos of the group so we could look at and measure behavior in the group. And we use the BASC for anxiety and mood. So today we've talked about social emotional learning, its nature, assessment, research, and some interventions. Well, thank you so much.